Hello, thank you for having us today as featured speaker. I'd like to introduce myself. My name is Sandra Parker. I'm the Provincial Nurse Manager in the Office of the Chief Coroner, and my colleague will introduce herself as well.
Hi, Gina Skagos, Executive Officer at the Office of the Chief Coroner.
Today, we're just going to have a little bit of a dialogue about our case management system and how we collect data and how we use the data in the province of Ontario, Canada, to ensure that we continue to meet our mandate of quality death investigations. So I will be starting with a few questions for Gina. And then based on her response, I may have follow-up or we may just proceed with additional questions. So Gina, welcome. And thank you for taking the time to answer some of my questions. Recently, the Office of the Chief Coroner implemented an innovative, fully integrated, data-focused death investigation case management system. It was something that was a big deal. So can you please highlight how this was achieved?
Thank you, Sandra, for your question. The OCC, or the Office of the Chief Coroner in the province of Ontario in Canada, as Sandra mentioned, continues to strive and provide high-quality death investigations to, namely protect, preserve, and enhance the security and safety of Ontarians in Canada. Over the past several years, we at the Office of the Chief Coroner undertook a very large organizational transformation, which included, the implementation of what I'll get to shortly as Quincy. And we went from a paper-based system to a paperless-based system to ensure that our vision in this organization to maintain high-quality death investigation remains as a top priority for efficiency and effectiveness. And so, as I mentioned, gave it away a little bit, Quincy, the name is coined, is the electronic case management software that we implemented and we developed from a COTS solution, which aligns with the organization's vision and strategic plan that supports our future direction here in the office. And to answer your question, Sandra, on how this was achieved, it was a very, very large task. The organization is composed of about 800 users of this solution, of which 350 to 400 are coroners specifically. And so we were maintained and always focused on the users to set this up for success. And so we had a series of users that formed the subject matter expertise working group that formed a part of the change champion cadre that were used to support the IT implementation of this. Another key to this success and how we achieved this was doing all the groundwork up front. A large group of users were involved in what was called the business process review several years back that informed us of our current pain points in the death investigation system, which allowed us to focus on solutions to trace ourselves a roadmap to the future and led us to success for implementing business process consistency across the province of Ontario in Canada. The next main piece of this that allowed us to achieve success was hiring the correct vendor to provide us with a data management, data capture COTS solution. A few key pieces and elements here is we have a large user group. As I mentioned, there's about 700 plus users of this solution across the province. We need it to be internet-based, device agnostic, and provide high level of security and access by its users. Another key piece here was that it was a fully integrated case management system, end-to-end solution for death investigation across Ontario, which allows key first responders and partners and stakeholders, forensic pathology, the folks who do the autopsy, forensic sciences, the folks who do toxicology, biology, and chemistry analysis for us, and any other key points of intersection here with special investigations unit have access to the system. Ultimately, all of this to allow for the right professionals to have access to timely information to support families in time of need. That's really what we are focused on here, is supporting families in their worst case scenarios. A large key to this success also included phased implementation. We took our time in implementing this, knowing that this was a very large implementation. We did a phased implementation focused on a small region that was controlled, had lessons learned a lot from that, tweaked the database to align with the information that we had then received from our users, and move forward with implementing it across the province of Ontario, which happens to be the largest province in Canada, population-wise. In terms of magnitude as well, we manage about 20,000 death investigations on an annual basis. The last key point here in terms of moving forward, the organization implemented what's called a Continuous Improvement Committee to continue to proactively listen to our users, act, and where necessary, make changes and share information along the way. Back to you, Sandra.
So thank you, Gina. For an organization the size that we are, this must have been a very monumental task to ensure that we had a system that was efficient and effective in managing cases, as well as the ability to collect data. My second question to you, Gina, is now that we have the system, I can imagine the amount of data that we've been able to gather or collect. So can you discuss some of the data that the system is currently collecting that will enhance public safety?
Thank you, Sandra, for your question. At the Office of the Chief Coroner, our focus was always to have an expandable platform and database that provides consistent data collection and information sharing. And so we achieve this by many means. As Sandra, we've come a long way. Province-wide. Pre-Quincy, we had what's called sort of individualized regional focus coroner reports that were the submission of paragraph reports written by our physician coroners. Very difficult to extract data, understand consistency across that. And so our focus was to standardize the data collection process and the reporting process. And the way we achieved this was through our users and stakeholder groups. So we formed these subject matter expert working groups to develop a series of 25 to 30 death type templates. And so similar to every business, we have lines of business, if you will. It just happens that this is in death investigations. And so of interest to the audience here, death type templates include items like gunshot wounds, multi-vehicle crashes, multi-vehicle fatalities, drug toxicity, so the overdose cases, drowning, aircraft, falling from heights, etc. And so about 25 to 30 different death type templates with a series of questions that apply to those death types were developed by our user groups, but also stakeholders and advocacy groups across the province and across the federal government as well, to make sure that we capture all of the necessary information required for each death type. Agnostic to a death type is also the need to have general template created for each case. And so we had a separate subject matter expert working group that created a general death type template that would capture information across all of the cases. And so each death investigation is a series of questions with a series of preferred responses, or responses could be typed in by the user, that enables the ability to report death investigation data across similar cases in a consistent way, and that is recordable and understandable to the people that are fundamentally making the decisions. And so this aids in the analysis done by the epidemiologists, who are the subject matter experts in researching and reviewing information that's provided and reporting from our death investigations unit. Our internal DASH unit also, so we have a data analytics and safety for health division, and our partners at the federal government, local government, and advocacy groups also receive this information to enhance public policy and safety in the future.
Thank you, Gina. Clearly, having a system where we can report and use data that's accessible to our stakeholders to enhance public safety is an important component to the organization. So this information is very enlightening to us, and I'm sure to the audience, Gina. The last question that I had for you is that data is powerful. We all know that. And the use of data is very, very powerful. So, can you briefly discuss how the Quincy data drives and enhance public safety to prevent similar deaths from occurring in the future?
So, at the Office of the Chief Coroner, our one of our primary goals is to enhance public safety for people that live in Ontario and inform public safety measures to stakeholders across the federal government and other governments worldwide. And most recently, with the COVID-19 pandemic, it publicly highlighted the growing and vital role for our organization, which is known as the Office of the Chief Coroner and the Office of Forensic Pathology Services, who are key partners in providing forensic services and autopsies to us, is the data collection and information that's shared with public health. In fact, Quincy was implemented during the pandemic to align with the launch of the DASH unit, which is that data unit I was speaking about earlier. So during COVID-19, there were requests for reviews of deaths directly and indirectly related to the pandemic, with a view to provide recommendations to prevent further deaths. With Quincy data, our team was able to quickly respond to these requests and other similar instances. For example, the opioid-related cause of death to public health and information on COVID-related deaths. So if we just unwrap a little bit the opioid-related cause of deaths, there's an opioid a challenge in many jurisdictions across the world. It's a growing challenge that many people are attempting to manage from our office and stakeholder groups and public and local health agencies. And so data provided from our office that on cause of death related to opioid related items was provided to local governments to inform them on their need to expand surveillance, enhance access to naloxone kits, which are saving mechanisms to folks who are going through this very challenging time. And of course, also inform the need to expand and review the safe injection site initiatives that were, provided by levels of government. And so, having information at our fingertips and providing it to the right local agencies allows us to provide the information to the right people to make informed decisions in a timely manner to really turn around public policy and save lives in the current state. Before we implemented Quincy, we still had access to data, but it was not as timely because we were, as I mentioned, we were working with the scanning the reports functionality and using AI to review the reporting of trying to find similarities across reports. We also use what's called the inquest function. It's very labor intensive, resources are very heavy, and it could potentially be months and years in delay. And so, we wouldn't necessarily have immediate impact. One other example that I like to use is the graduate licensing program. And so through the power of our data before Quincy, there was a heightened level of deaths in youth driving, which drove us to conduct a review, included multiple policymakers, and that's where the graduated licensing system came from. Was the need to amend the licensing program to have people go through driving school and then having a graduated licensing program to full driving capabilities to prevent and enhance public safety and prevent similar deaths from occurring in the future. So those are a few examples, Sandra. We deal with this on a daily basis. There's numerous ones that we can highlight here, but given the time restrictions, I've given two quite interesting and relevant, probably to all of our households, that we can take back to ourselves. So,
yeah. And I'm familiar with the graduated licensing system, and that took a number of years. But I believe now with Quincy, we have more information quite readily at our fingertips. Correct.
That's right.
So, Gina, thank you so much for this informative dialogue. You've really highlighted how we are able to, the Office of the Chief Coroner is able to capture data, how we use the data, how we partner with key stakeholders to develop public policies to enhance public safety. And of course, just to ensure that data drives policy enhancement so that it does save lives. Of course, the organization's motto is that we speak for the dead to protect the living, which is indeed what our organization aims to do. So thank you again.
Thank you, Sandra.